As facilities do their best to give every patient what they need during the COVID-19 pandemic, proning has been shown to be an effective way to improve oxygenation to the lungs. Most of the proning videos available online show 2 to 3 flippers on each side, wrapping the patient like a burrito with pillows on top of their chest and stomach so that once flipped, they are laying on the pillows for support. And one more person controls the patient's head and manages the ET tube and the lines. With COVID-19, there are so many more patients who need this treatment several times a day. There's limited staff and PPE, making it challenging to have enough people. And we now know the virus can be airborne once aerosolized, so we must aim to keep the movement of air in the room to a minimum. This activity can also put caregivers at risk of back injury. Our aim in this video is to show how to use a ceiling lift to prone a patient. We would have one more person at the head of the patient during the entire procedure. However, due to social distancing, family members are the helpers and the patient. Training staff to help with this activity is not difficult. This video is for instructional use only and does not prescribe medical treatment. It is a simulation with a live actor as the patient, with lines and tubes placed for visualization and management during the activity. Ideally, all ICU beds with ceiling lifts should be made up with a repositioning sling before the patient is on the bed, but again, that is not always the case. You can use the folding and unfolding technique to place a sling under a patient without having to roll them side to side. Once under the patient, you unfold the friction-reducing devices and the sandwich sling between them. The friction-reducing property prevents any friction on the patient's skin and allows the sling to be placed without undue stress on the caregivers and with minimal movement of air around the room. Usually this technique is done from the head to the feet, but in order to try and keep the head of bed elevated as long as possible and to prevent the patient sliding down the bed, we show a modified version beginning at the feet and unfolding towards the head of the bed, taking care to observe lines, tubes and drains. We show sandwiching the sling between the FRDs on the patient. However, for COVID-19 or any airborne conditions, ideally this should be done before approaching the patient to minimize airflow. Place the folded sling sandwich under the patient's legs and then unfold each fold, ensuring you are both on top of the chuck, always checking lines, tubes and drains as you unfold, taking extra care around the arterial line and chest tube and continuously ensuring the integrity of the ET tube. If the patient is able to tolerate laying flat, even for a brief period, it will make it easier for the last couple of unfolds as you are close to the patient's head. Once you are ready, unhook any lines that can be safely disconnected, such as the nasogastric suction and cardiac leads, making sure you remember to reconnect once you've finished. Move the pumps and lines when possible to the other side of the bed. Double check all before lifting. ET tube, arterial line, IVs, either peripheral or central if they have them, chest tubes and Foley catheter. Lower the bed to give greatest clearance for the lift to turn the patient over. Attach all the straps to the hanger bar using the shortest loops at the hips and longer ones at the head and feet of the patient. Double check all lines if you have not done so before. Place the Foley on the sling so it does not pull as you lift the patient. Lift the patient on the repositioning sling and place a second sling underneath the patient but on top of the underlying FRD so that you always have another sling underneath the patient to turn them back to supine when it's time. Each time you turn the patient, place a new repo sling under for the next time. The friction reducer will enable you to push the patient to the side so they remain in the centre of the bed as you turn. Once the patient is positioned to be turned, unhook the straps and turn the hanger bar to the side, reattaching the loops on the near side. Begin turning and sliding until the patient is on their side, taking care to tuck the free straps of the sling underneath them so that they come out easily without pulling on the patient once proned. This was feedback from the patient that pulling straps out from underneath them was very uncomfortable. Place the pillows on the patient's chest and pelvis, tucking slightly underneath the patient. Check the ET tube one last time before completing the turn. Then raise the ceiling lift and at the same time slide the patient on the friction reducing device and tuck the pillows under as they come onto their stomach. If the straps have been properly tucked, they should come out easily as the sling is moved away. An alternative way to place the pillows is to place on top of the patient and secure with a sheet before you hook the sling to the lift. Tuck the sheet under the arms like a burrito as in the manual technique, and this helps further secure the IVs and arterial lines. In both techniques, it is helpful to cross the top leg over to help with the turn. This technique helps to keep the pillows in place during the turn, but of note, there is no lifting by the caregivers. The ceiling lift does the work and the slide sheets enable you to slide the patient across the bed without friction on their skin and with minimum pushing and pulling force by the caregivers. Care is needed to remove the straps as before. Double check ET tube in all lines. Place a pillow under the knees, which is not shown, and reattach all disconnected lines such as the NG tube and cardiac leads. And if the patient is able, position the arms in the recovery position with supports underneath both arms. The second repositioning sling is also now in place for when the patient is ready to be turned supine again.